Hi, my name is Lucy Adams, and I will be presenting the poster on the role of the nurse in the treatment of persons impacted by Lyme disease. So some background, most of you know what Lyme disease is most likely, but it's a tick-borne illness caused by the bacterium Borrelia burgdorferi, carried by black-legged ticks. There are a lot of cases in the US every year. In 2015, 38,069 were confirmed and probable in the US. The first presenting symptom, which is typically in about 70 to 80% of patients, is a rash that we call a bullseye rash. It's technically known as erythema migrans, so develops at the site of the tick bite. Other vague symptoms that people with Lyme disease present with could be fever, chills, headache, joint aches, swollen lymph nodes. So this could be similar to like the flu or something like that. So due to the vague nature of these symptoms, because it could really be anything if the rash isn't present, a Lyme disease diagnosis is not always made quickly. So some patients experience lingering symptoms, which is referred to as post-treatment Lyme disease syndrome, and this can last for months to years, unfortunately. So nurses should be aware of these vague symptoms so this can contribute to an accurate diagnosis, so people can try to avoid these long-term complications that can come about. So the purpose of this research was to identify the effects and complications that can result from Lyme disease, identify the barriers in caring for the persons with Lyme disease, and to identify the best practice in the treatment of it. So a literature review was conducted, including the databases CINAHL and PubMed to conduct. Keywords used were Lyme disease, barriers in detection, barriers in treatment, and best practices in treatment. So our findings in terms of the barriers, due to this misinterpretation and attribution of symptoms, an over-reliance on a bullseye rash has developed. We rely on that because of the vague nature of like the flu-like symptoms, the joint pain and fever. So there are a lot of delays in diagnosis of Lyme disease. Even with the correct laboratory test, there is a 50% chance for incorrect diagnosis. So the testing only becomes more accurate as the disease progresses. Lack of insurance or insurance issues can make care not accessible. Nurses have found that there are limited research on ticks and incentive to conduct Lyme disease research. Evidence-based information is limited related to barriers to Lyme disease prevention, diagnosis, and treatment, and barriers to Lyme disease management are a gap within the literature, is what we found through this research. So the best practices summary, the use of repellent-containing DEET is effective for repelling ticks, and wearing clothes that cover all parts of your body when going in wooded areas or outside in high grass has shown to be an effective method of prevention. Nurses should teach patients to check themselves, especially in the hot spots, areas of heat like the groin, armpits, by the hairline, under your bra, following any outdoor exposure. A thorough physical assessment and subjective history are necessary to properly diagnose and treat Lyme. A short-term course of antibiotics, which is usually doxycycline for 10 to 21 days, is typically curative for patients whose illnesses are caught early on in the process. Patients who are experiencing pain and swelling in their muscles and joints can benefit from NSAIDs, along with using ice and heat to manage their symptoms. Nurses should be aware that persons treated properly may still end up developing the PTLSD, which is the lingering symptoms of Lyme disease. And for patients experiencing this, alternative therapies such as cognitive behavioral therapy, exercise and physical therapy, changes in diet, and energy conservation have shown to help. So the implications for practice from this research are included below too. Healthcare providers should be better educated on the prevention and treatment of Lyme disease. 2, nurses are in a unique position to provide patient education regarding prevention and treatment, including the use of repellent and taking the full course of antibiotics. And thirdly, evidence-based research is needed to better understand Lyme disease and the symptoms so we can better diagnose it and hopefully stop the occurrence of the post-treatment Lyme disease syndrome. All right, thank you, and I hope you guys enjoyed.